anybody else remember the commercial from the 1970s? It was a public service commercial from the American Dental Association. And one of the people on it was a little girl who said, "If I didn't have any teeth, I couldn't eat, and how could I be happy?" Well, my brother and I kind of thought that was funny, but we were just kids. We thought lots of stuff was funny. But as I've gotten older, I have realized the wisdom of dental hygiene and taking good care of your teeth because you need them. Well, hello and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam, and I've been living with multiple sclerosis for 38 years. And in the course of the videos that we've been doing lately, we've looked at all kinds of factors that contribute to good general health, regardless of whether they're related to MS. But sometimes we're also finding that people with MS may struggle a little more with some of these factors. The one we're going to look at today is dental hygiene or oral hygiene, or basically teeth. Does having MS make it more likely you're going to have teeth problems, or is it more the other way around? Do bad teeth contribute to the possibility of developing multiple sclerosis? And a whole bunch of other related things, like how can I take care of my teeth to make sure that I don't contribute to more MS problems? I'm going to look at all of that and what others have to say on the subject. The first source we can look at together is out of MS Magazine, and of course we'll put the link below. It's called Your Teeth and MS, The Importance of Oral Hygiene. It's actually something of an older article. It came out in 2016, but I think the information is still pretty relevant to today. As they say here, MS and other chronic illnesses can have a harsh effect on our oral health. To have good oral health, we need good manual dexterity to brush and floss properly. People with MS are not always able to do this very well. Fatigue and mobility problems can interrupt oral health. Don't just focus on your MS-related symptoms. Facial pain, such as trigeminal neuralgia, can cause problems or interruptions with a regular oral health regimen. See the Journal of Oral Maxillofacial Surgery for more. And I can attest to that because I have had trigeminal neuralgia from time to time. And whenever I go in for dental work, I have a discussion with my dentist about my trigeminal neuralgia, my concern that the procedure might trigger the trigeminal neuralgia, even if I haven't had any symptoms of that for quite some time. I recently had a couple of teeth extracted, and instead of having the dentist do it, I went to an actual oral maxillofacial surgeon, and he was very familiar with trigeminal neuralgia. He assured me he'd done this 100 times and he was not going to trigger anything, and he didn't. Continuing on, some medications used to treat MS symptoms or others, such as anxiety and allergies, can cause dry mouth and bacteria accumulation. They go on to say there are studies that show that people with MS have high rates of tooth decay, dental caries, and periodontal disease or gum disease. These will affect our oral health in a number of ways. So that is an interesting thing to know, that apparently people with MS have statistically higher rates of cavities and gum disease than the general population. When our mouth, gums, and teeth are not in good condition, eating and digesting healthy, nutritious foods becomes more challenging. Poor hygiene may lead to infection, which can worsen MS symptoms as well as our self-esteem. There are several medications that can lead to negative consequences in oral health. Dry mouth is one of the most common. There are several drugs that cause dry mouth. Talk to your doctors and your dental team to see what these are and how to protect your teeth and gums. If your medications are causing dry mouth, these tips may help. Regularly sip water and sugarless beverages. Avoid caffeine, tobacco, and alcohol. If you do, drink these, then add more water as needed. Check to see if you might have other conditions such as Sjogren's, use over-the-counter dry mouth supplements such as biotin rinse and lozenges. Alcohol-based rinses will only escalate dry mouth, so avoid them. And then finally, brush and floss, see your dentist regularly, and follow instructions as needed. Now, this next article I looked at is interesting because it's written by dentists for dentists. So you're going to notice in here that they've got more of a professional-centric rather than a patient-centric focus. But I think in a way that is useful for us because we can see how aware the dental field is of the unique needs of people with multiple sclerosis. The title of the article is Oral Health Risks of Multiple Sclerosis, and it came out in 2017. I'll link that below as well. Here's what they say. Challenges to oral health. Individuals with MS are at increased risk for dental caries, gingivitis, and periodontitis due to the physical effects of MS as well as these patients' reduced immune response. Customized dental treatment planning and customized oral hygiene regimens must be implemented. Table 2 provides a potential care model when treating patients with MS, and those are footnotes there, I assume. Systemic inflammation is a trigger for MS, and chronic periodontitis contributes to inflammation. Basic periodontal treatment that removes supragingival and subgingival biofilm and calculus, in other words, the scale that's on your teeth that they chip off, can reduce the inflammatory response in the entire body. Compared to those without MS, patients with MS tend to have more extensive gingival disease, gum disease, and an increased number of decayed, missing, or filled teeth. Well, interestingly, I inherited my lousy enamel and my tendency toward cavities. My mother is in the same boat, but my mother certainly does not have MS. So it's one of those things. It's hard to say which is the cart and which is the horse. What's the cause and what's the effect? But I do have MS and I do have bad teeth, so I guess I'm a data point. They continue. Toward this end, obtaining a patient's medical and prescription information prior to the appointment is helpful. The consultation phase of a dental appointment is highly important. I'm not really sure that we tend to think of dentists as the same way we think of neurologists or other doctors, where before they do anything, we sit and talk with them. If we have special considerations or concerns, we need to express those because they can't read our minds. And even if we've filled out the form and said that we have MS and said that we have had trigeminal neuralgia, that does not mean that they are going to actually have that in the top of their mind when they sit down to look at our mouth. So make sure you say something before they stick that thing in your mouth and you're not able to talk anymore. Not only does smoking contribute to the worsening of MS symptoms, it encourages progression from relapsing MS to progressive MS. And we've heard that in other videos that I've made. When oral health professionals provide behavioral intervention for tobacco cessation, individuals may be more likely to quit or avoid using tobacco in the first place. Dental professionals should be prepared to direct individuals to smoking cessation resources. So good to know. You might take advice from your dentist about quitting smoking if you're caring even cosmetically about the look of your teeth. Whatever works, but as I've said over and over again, smoking is one of the worst things anyone can do, but certainly anyone with MS should avoid smoking. Many factors, they say, need to be considered when treating patients with MS. Short morning appointments are best when providing routine dental and dental hygiene care. I would actually agree with that, because I do much better in the morning. I don't know if all of you are like that. Some of us are more afternoon or late night people, but for me, I do try to always get a morning appointment. Oral health professionals will need to alter treatment plans and procedures if the patient is experiencing pain, paralysis, spasticity, difficulty swallowing, and/or fatigue. Most patients with MS can adequately state preferences for care and oral health values. Those with more advanced stages of disease may need a caregiver or guardian included in discussions about oral hygiene methods and the most comfortable treatment adaptations in the dental office. In order for dental treatment to succeed, clinicians should listen attentively to the concerns expressed by the patient and/or caregiver. In other words, no gaslighting. We had a video on that. But at least these folks that wrote this article are very aware of the need to listen and be respectful and attentive to what we are concerned about and what we feel we need. There are some tables in here that help dentists make some decisions about how to treat people with multiple sclerosis, and it was very good to see this. And since I've linked this article below, if you're curious if this is something you would like to consult and then maybe bring to your next dental appointment, that might be a really good idea. And now they go into a little more detail about dental office adaptations. Keeping outdoor and indoor walkways clear. Noticing changes in the patient's gait, mobility, or dexterity. I think my hygienist actually pays more attention to that because she's the one that comes into the waiting room and calls me back. And then by the time the dentist sees me, I'm sitting in the chair. So I think the dental hygienists also need to be aware of this kind of thing. And I don't know if they are actually, to tell you the truth. But that might be something to ask them. Choosing an easy access operatory. Helping patients open building and restroom doors if needed. Scheduling follow-up appointments in the operatory instead of the reception counter. Remaining flexible with appointment objectives, realizing that all procedures may not be completed in one visit. Keeping up to date with medical transportation options. Letting people know what those are. Initiating an open dialogue as to how to improve on future appointments. I like all of these. I hope that you're feeling as encouraged by this particular article as I am. Like I said, it's several years old, but by now maybe dentists have gotten a little bit more insight into the special needs of people with multiple sclerosis. And here is a table. This one is about medications used to treat multiple sclerosis, and also the dental implications of those medications. So, excellent stuff. Really good for dentists to know all this. The next article we will look at is of an article that was published much more recently. It was in May of 2022. It's called What to Know About Multiple Sclerosis and Dental Extractions. And this is out of Healthline. They do tend to keep their web pages pretty up to date. So dental hygiene challenges, according to Healthline, are as follows. Multiple sclerosis can make it difficult to keep up with your dental hygiene. Symptoms of multiple sclerosis may cause the following. Tremors that may make holding a toothbrush and brushing a challenge. A weakened grip that can make holding a toothbrush difficult. Fatigue that can easily make daily tasks overwhelming. Facial soreness and numbness that make daily brushing and flossing painful, or perhaps even hit or miss and uncertain. I think if you're numb, sometimes you're not really sure what you've covered and what you haven't. Depression and other mood changes that can affect your motivation. And then they talk about medication challenges. Additionally, people who have multiple sclerosis are often prescribed medications that can cause dry mouth and sugary dietary supplements that can lead to plaque buildup. These medications and supplements can cause unwanted side effects like tooth decay and gum disease. And as we saw in the previous article, having a buildup of plaque can actually increase inflammation throughout the body. So not a good idea to let that just go. Even if you don't have any cavities, the plaque buildup may cause you problems. And as they say, it can be difficult to manage these side effects while you're managing the other symptoms of multiple sclerosis. So true. And then they go on to talk about dental care challenges. Not all dental professionals are used to treating people with multiple sclerosis. Well, by now I would think most of them are, but you never should assume that. Often their offices are not set up for people with multiple sclerosis and might have dental chairs that are inaccessible or painful to sit in for long stretches of time. Other common dental care challenges for people with multiple sclerosis include the following: an inability to keep your head still and in the correct position during a dental exam, respiratory issues that make it difficult to take deep breaths while fully reclined in a dental chair, dental pain and numbness that makes it hard to hold the mouth open without assistance. And then they say, how does multiple sclerosis affect dental extractions? This is an important topic. Dental extractions strike fear into the heart of many people, not just those with MS, but those of us who have MS, and especially those who have had trigeminal neuralgia, are really leery of something like an extraction. They say regular dental visits can be a challenge for people with multiple sclerosis. Visits for procedures such as dental extractions can add to those challenges. Tooth extractions require longer visits and can add to the pain and difficulty of standard dental work. The exact challenges and accommodations depend on the patient, the severity of their symptoms, and the number of extractions needed. Well, I mentioned before, I've had to have 2 teeth extracted, both molars in the back of my mouth. And when I did that and I went to the oral surgeon, I had him put me under anesthesia because I did not want to even imagine what was going on, and I certainly didn't want to even think about pain. Common steps a dentist will take when a patient has multiple sclerosis include these: taking breaks in the procedure every 5 to 10 minutes to ensure comfort. I did have a dentist one time, and it had nothing to do with MS. He was just that way. He would pat your shoulder and ask you regularly, were you doing okay? Or praise you and tell you you were doing great. Was everything all right? And I so much appreciated that. Using a mouth prop so that the patient does not have to hold their mouth open on their own. Using specialized cushions or pads on the dental chair. Coordinating with the patient's primary care doctor about medication doses on the day of the procedure. Now, going back to that third bullet just a minute, the cushions or pads I never had, but one thing that I've had a couple of times, the hygienist will say, are you cold? Because they always keep the air conditioning cranked really high in those rooms, and they'll give me a blanket. And that is great. I really appreciate it. So, if you find that the room is cold, never hurts to ask. They probably have them. They may not think to ask you about it, but you can always ask. Over time, multiple sclerosis can weaken the gums. If your gums are weak and multiple sclerosis has made dental health challenging, a dentist might recommend dental implants as a solution for this issue. Now, that's a whole nother can of worms. My dentist wanted me to have implants for those teeth that I had extracted, and I chose not to because I just thought it's an unnecessary surgery, especially at my age. I mean, I'm 60-something, and the teeth are in the back of my mouth, and it's not a cosmetic problem, and I have 2 sides of my mouth. I can certainly chew on the other side. So I just said, no, thank you. You may make a different decision, but work with your dentist and your dental team to make sure that if you have any concerns, they are addressed before you get in the middle of the dental surgery. Dental implants are more permanent than dentures and often considered a better option for people with multiple sclerosis. I don't know. That's, like I said, that's kind of debatable. It sort of depends on you and what you really want. Consult with both your doctor and dentist for advice on how to proceed with the dental extraction. A dentist can tailor an extraction procedure to meet your individual needs. This is true. I have had that happen, and as I've said, it worked just great. I was very happy with the result. And then here are some resources that are available to help address dental care challenges if you have MS. They've mentioned the electric toothbrush. That is a good one because then you don't really have to be good at brushing. And it can get into some hard to reach places that regular toothbrushes have a hard time getting to. They also recommend wide or long-handled toothbrushes for kind of the same reason. Plastic flossers. Okay, I use these, and I will put a picture up here so you can see what they're talking about. Because regular floss, I'm just too klutzy. I can't really deal with it very well. A water pick also can be used to clean between your teeth. It's easier to manage than flossing. Okay, but it doesn't totally substitute for flossing. They don't really say that. But I think especially if your teeth are close together like mine tend to be, a water pick may not be all that effective, really. An option if you can't floss. A weighted glove is another one. A weighted glove can help keep your hand from shaking while you brush. And then finally, bathroom seats. Stools and benches in your bathroom can give you a place to rest while you brush. And now here are some tips to improve your dental hygiene. Avoid smoking. Well, there you go. Once again, avoid smoking. Stay hydrated. Drink water. Avoid dry mouth. And help your mouth stay cleaner. You're getting rid of some of the bacteria buildup if you're drinking water. Use a humidifier. A humidifier can keep the air around you moist and help prevent dry mouth, especially at night. Chewing gum. Chewing gum encourages saliva production in your mouth. This prevents dry mouth, and that can help prevent cavities. Sugar-free gum, of course, is recommended. Making regular dental appointments. Seeing the dentist regularly is an important part of staying healthy. And, I agree with that. I was in the dentist chair the day Ronald Reagan got shot, and the college that I went to had a dental school attached to it, and they would let you have your dental visits for free if you were willing to let a dental student work on your teeth. Well, this poor fellow, he was trying to put a filling in, but he was having the devil of a time, and it took 3 hours. They had the radio on. I was listening to the news reports about Ronald Reagan being shot and Jim Brady being shot, and it was really a very distressing day. And as a result, I didn't go back to the dentist for like another 6 years, and by the time I went back, I had a mouthful of cavities. So not recommended that you put off going to the dentist, even though that had nothing to do with MS. Eating a well-balanced diet. We've talked a lot about this. Limit foods high in sugars and acids. They're not good for you and they're not good for your teeth. Replacing your toothbrush every 3 months. Now this is one I've started doing. I didn't used to. Every 3 months or whenever you have a cold. Once you've recovered from that cold, get rid of the old toothbrush because you do not know what bacteria, viruses, or other baddies are on there. You don't want that, so just get rid of it. And certainly, any toothbrush that you dislike using for any reason, because it's too hard, because it's too soft, it's hard to hold, whatever, don't keep it. Get a different one. They're not that expensive. And if anything that discourages you from brushing your teeth, you don't want it in your life. So go ahead and change what you need to change. Frequently asked questions about multiple sclerosis and dental care. Can multiple sclerosis affect the nerves in the teeth? Multiple sclerosis can cause a type of nerve pain called trigeminal neuralgia. It's not in your teeth, but it's a nerve pain on the side of your face. And yes, I know a lot about that. It's not fun. It's like about the worst pain I've ever had in my life. So now that I'm not having it, I don't want to do anything to trigger it if I can do that. However, this pain is often felt in the teeth and in the jaw. Yes, that was the one that I had. That branch of the nerve was the one that was bothering me. It felt like somebody was shooting 1,000 volts through my jaw and the teeth. It can make having dental work or even brushing your teeth very painful. Well, it can make dental work scary, that's for sure. I have yet to go into the dentist without reminding them that I do not want them putting Novocaine into the hinge of my jaw because that's the trigeminal nerve right in there, and we're not going to be sticking needles in it. Thank you very much. Now, here was an interesting question I never heard anyone ask. Can a tooth extraction with multiple sclerosis lead to a stroke? The answer is no. There's no link between multiple sclerosis, tooth extractions, and strokes. If you've heard anything like that, let me know, because that is news to me. Are there certain dental treatments you should avoid with multiple sclerosis? Usually not, but multiple sclerosis can vary from person to person. Even people with the same type of multiple sclerosis can have very different symptoms and progressions. I'm glad they said that because it's oh so true. Since this is the case, some people may have specific symptoms or take medications that could potentially interfere with certain dental treatments. Talk with your doctor and dentist before you have any treatments to make sure they are safe. And then the next question is the risk for post-extraction infection greater due to a multiple sclerosis weakened immune system? Well, that's interesting. We just did a video on multiple sclerosis and the risk of infection, where we read that multiple sclerosis does indeed increase your risk of infection. So what do they say about this? Although multiple sclerosis is an immune system related condition, it does not directly weaken your immune system. It causes your body's immune system to attack healthy nerve cells, but does not prevent your immune system from fighting infections. This means you're not at increased risk of post-extraction infections. However, many people with MS are on medications such as corticosteroids that can lead to a weakened immune system. This is why it's important to tell your dentist about all the medications you take before you have an extraction or any other dental procedure. And they say you might need to take antibiotics to prevent infection after your extraction. If you do develop a dental infection, it may lead to a pseudo-exacerbation. So an exacerbation that isn't clinically real, quote unquote, but is certainly real to you. It's a temporary increase in multiple sclerosis symptoms. The last issue I want to talk about is mercury fillings and multiple sclerosis. This was a hot topic some years ago, and as I went out looking for papers and other scientific literature on the subject, I found that most of the stuff dated, 10, 20 years ago. It was hard to find anything really current. This is about the most current thing that I was able to find. Dr. Beaber put out a video in November of 2019 asking the question whether mercury causes multiple sclerosis. His slide on the sources of mercury was useful, I thought, because of course we all know that there's mercury in those old silver dental amalgams, but there's also mercury in some vaccines and in some mascara, and in fluorescent lamps, in thermometers, maybe not so much in current thermometers, but certainly when I was a child, all the thermometers I knew had mercury. Electrical switches and certain medications such as diuretics still to this day contain mercury. I'm pretty surprised actually at that. But so he says, or at least that was true in 2019 when he made the video. And then he's highlighting dental amalgams because that's really the subject of this video. He says mercury vapor is released from dental amalgams and absorbed by the body. The number of fillings is linked to urine mercury concentration. So there are studies that have shown that. Nicotine chewing gum. Now this is new to me. Nicotine chewing gum and dental amalgams raise mercury levels. So something about that particular kind of chewing gum releases mercury from your dental fillings. So bear that in mind. There's no reason to stop your smoking cessation, but it does something to keep in mind. And then bruxism, which is grinding your teeth, may increase exposure. Well, I guess that would make sense. It's sort of a mechanical action that might chip away your amalgam fillings. One thing, by the way, that I found out that I didn't know, and maybe you knew, and this is old news, but amalgam fillings they do not adhere to your teeth. Like the newer stuff that they use now actually adheres to your teeth, so it's on there really good. But the dental amalgams, they're soft. They're kind of like Play-Doh in a way. You just kind of cram it up into the tooth, and because the teeth have all these crevices and folds, the filling is essentially packed in there. And that's why a lot of times we lose fillings, because they're really not on there all that securely. So bruxism could actually cause an entire filling to dislodge. Now, Dr. Beaber presented the evidence for mercury fillings causing MS or hurting MS, but he also presents an awful lot of contrary evidence, and I'm not going to go through all of what he says because he's got a lot in here. So I'm linking the video for you to watch. But you can see that the main thing is that mercury usage has actually decreased by more than 50% since 1980, and yet worldwide MS is increasing. And in some countries, amalgams are even banned. And then the bottom one was interesting, that people with MS have less liquid soluble mercury in their brains on autopsy than controls. No real explanation for that, but interesting, don't you think? I'm going to let him talk about this slide and also just his concluding remarks, because I do think he's got some very good points here, and they're all based on research, even though he hasn't listed all of the references. I recognize some of the studies he talked about throughout the video because I did look at them. They're older studies. In modern times, there doesn't seem to be as much research on mercury fillings and multiple sclerosis, but I think that probably that's because mercury fillings are actually being phased out pretty much. I haven't even been offered mercury fillings by my dentist for, gosh, it's probably 15, almost 20 years.
This is a statement from the National Multiple Sclerosis Society, and I think it's very accurate. There is no scientific evidence to connect the development of MS with mercury-based dental fillings. Poisoning with heavy metals such as mercury, lead, or manganese can damage the nervous system and produce symptoms such as tremor and weakness, similar to those seen in MS. However, the underlying mechanism of the nerve damage is completely different from MS. Now, you may say, I already have a neurological disease. Mercury is known to be neurotoxic. Even if small levels of mercury exposure may not cause any problems, why take the chances? They're unattractive anyways. I want to replace them with white fillings. This is certainly a defensible position, but there are some risks to have your amalgams removed, so caveat emptor.
And then the final thing we're going to look at is something that's a little bit different from what Dr. Beaber was just saying. It's out of Multiple Sclerosis News Today. MS patients should avoid silver tooth fillings due to mercury, FDA advises. So the Food and Drug Administration advised that we should avoid it because we have MS. And that was published in October of 2020, which was not exactly ancient history. Here's the bottom line. People with multiple sclerosis are among the high-risk groups advised to avoid dental amalgams, silver-colored fillings that are 50% mercury, under new recommendations issued by the U.S. Food and Drug Administration. Mercury vapor released from fillings can be highest during placement or removal. The release noted that amalgams are misleadingly called silver fillings in the United States. That's very true. I didn't realize they had mercury in them for years and years. The other thing this reminds me of is that I haven't seen anyone say this, but I was counseled not to have all my mercury fillings extracted. I talked about that with the dentist years ago. He said that the act of removing them releases a lot more mercury vapor than it would if you just left them in place. And it would actually pose more of a risk. And there might also be the risk of swallowing some of the shavings or whatever. So he talked me out of doing it. And as it's turned out, all in the years that have gone by, I've actually either had those fillings replaced because they got loose, or because decay started to get in underneath them, or because I lost the tooth entirely, or whatever. I don't have nearly the number of mercury fillings that I used to have. And maybe if you're patient, the same can happen for you. Instead, the FDA recommends that dentists use mercury-free alternatives, such as composite or glass ionomer cement fillings. With these patients and with children, especially those under the age of 6, women who are pregnant or planning a pregnancy, nursing mothers, people with poor kidney function, and those allergic to mercury or other components of dental amalgam, the agency also advises against removing or replacing mercury-containing amalgam fillings if they are in good condition, unless it is deemed clinically necessary. As I said, dentists don't like to do it because there's more risk involved in doing it than leaving it alone. I just wanted to look at this last paragraph. According to the European Center for Environmental Medicine, the use of such amalgam fillings has been banned in Europe for pregnant and breastfeeding women as well as children under age 15 since July 1st of 2018. The European Commission is considering legislation to largely stop amalgam use by 2030. So once again, the Europeans are ahead of us as far as caution. And I think that's probably wise. There's no real reason to use amalgam fillings anymore. I don't know, is any dentist still recommending them? Do you have a dentist that does? I haven't heard of this in a long time. As you can see, like so much when it comes to MS, there are no definitive answers. Just wait a while, and the consensus of the scientific community is likely to change. But we do know there are some principles that we can be following to keep our general oral hygiene high enough that we shouldn't have any problems with our MS that's traceable to not taking good care of our teeth. I'd be curious to know how you might have dealt with some of these issues like mercury fillings, tooth extraction, any other dental procedures outside the norm. How has that affected your multiple sclerosis? Leave me a comment. I would love to hear from you. Well, that's all I have for you today. So until my next video, take really good care of yourself, and I will see you again soon.